James is a clinical psychologist, and he's actually going to introduce himself. So without further ado, I will hand over to James and look forward to hearing what you've got to say to us.
Thanks, Kate. I'm introducing myself because twice I forgot to give Kate my bio. So yeah, I'm the acting senior clinical psychologist and coordinator of the health department's clinical psychology service for adults affected by cancer. That's got a fancy name of the WA Psycho-Oncology service, or WAPOS, as it's commonly known amongst patients and health workers around the state. I'm a Perth boy. I've lived here all my life. I'm raising a family of 2 with my wife up in Joondalup. I've been working as a psychologist for about 20 years now, and initially that was focused in specialist mental health treatment settings, but in the last 15 years I've really focused in working with people who are affected by illness or disability, and I've been working at the Psycho-Oncology or Cancer Psychology Service for the last 11 years, or since its inception. I've got a few slides here. I've aimed to talk for about 20 minutes. I have got those details there, but I also do have a slide at the end which outlines some of the service options that are available for people, so you might see that information there again. So our service, as I say, is a clinical psychology service for adults affected by cancer. We do provide inpatient services at Fiona Stanley Hospital and Sir Charles Gardner Hospital, but we also provide outpatient services statewide. Now that's also delivered from Charlie's and Fiona Stanley, but we also do phone and telehealth work around the state. People can access us for individual care or for couples care. So care for the couple about how they're relating together as a couple, communicating sexuality issues and concerns, those sorts of things. Fortunately, it's without fee for adult Medicare card holders. As I've mentioned, statewide but Perth-based. And yeah, I'm going to talk today about living well with chronic cancer was Kate's sort of title or request. And so I'm going to talk a bit about that. I'm also going to spend a bit of time talking about some ways to think about when it might be helpful to get extra help from someone like myself. But I'm also going to outline a few of the counselling and support service options that are available in Western Australia for people to consider if they feel they could benefit from some professional assistance in living well with cancer. And like the other talks, perhaps we will have questions at the end, and I think we've got quite a bit of time free for Q&A, so that'd be great to be able to talk with you then about some of the questions you might have. Just in terms of today's talk from myself, and this is a little bit of a useful formula for thinking a little bit about how to work with some of the challenges that come up with our experience when we're encountering a chronic health problem. But particularly for this talk, just notice that you might experience some personal reactions. Some of that will be pleasant, unpleasant, new or familiar to you. And try and notice those with curiosity and without judgment. Okay? When we can be open to our experience as it's happening, we can let go of the struggle with that experience. It's often that struggle we have with what's showing up for us that really gets us in knots. So I really encourage you to sort of notice what's showing up for you and see if you can allow enough space for it to be there. And also notice if you need to sort of quell or turn down what's happening for you. And of course, look after yourself and the people you're here with. So if you find that you're getting really upset about something, yeah, feel free to leave if you need, or signal to us and we'll help you out. That might sound like I'm going to talk about all sorts of dramatic stuff, but I more want to include that slide again because it's a nice little way of thinking about how we can work with what happens for us in everyday life and also in being someone with a health problem. Also, I want you to note well that what I'm talking about today is quite generic, and that's particularly because people and families are unique. And cancer and its cancer treatment is unique for each person, and the needs and challenges, but also the opportunities you have are quite unique too. Certainly too, the goals you might have and your values that define living well are going to be very idiosyncratic for you and your family system. And therefore some of the strategies that I'm going to throw around also might be helpful, might not be so helpful. And that's a challenge, I guess, in coming to talk about living well with cancer, because people are so different and their circumstances are so different. Also, there's a bit of limited information for people affected by neuroendocrine tumours in terms of, and certainly research evidence about what it is that people with this tumour group or with this tumour experience in terms of mental health and distress, but also what helps them grow and prosper whilst being unwell. So I've struggled actually to identify good clinical research to present to you today about that. So I'm going to have to draw more on the general experiences that patients I've treated over the last 11 years have talked to me about. I am drawing on research evidence from other tumour groups which have been extensively studied, and also clinical experiences I've had and personal experiences I've had. Okay? So living with cancer, what's that like? Well, some people tell me that it's a journey. Has anybody here heard that phrase used? And there's that lovely little twee, inspirational poster, life, it's not about the destination but the journey. If you want to vomit, please do so now. A lot of people tell me, particularly at the start, that it's more like an earthquake or a bomb going off in their lives. And sometimes this can happen repeatedly over time. A lot of people use the roller coaster metaphor, or having to run a marathon that you never signed up for. And I think that one's particularly apt for people who are living with chronic illness, and particularly for people with low-grade neuroendocrine tumours. We are talking about how do you live and endure over a long course of time. Okay, how do you adapt over that time? So yeah, I think a lot of my patients would say, yeah, I'm running a marathon, or I have to keep running a marathon. And we know that having to cope with cancer involves lots of impacts on people. So the most common cancer symptoms that are reported are fatigue, pain, anxiety and depression. There are lots of physiological effects of cancer, of the actual tumour itself, that we have to deal with. There are treatment side effects, but also we come to cancer with pre-existing mental health concerns potentially, but also having to pay the bills, children who misbehave, past losses, all sorts of challenges. So all of these things have a bearing on how we get along with people, how we function in our roles and fulfil our responsibilities, and ultimately our health and well-being. And I guess we do know that living with cancer can involve, so notice my language, can involve, it doesn't necessarily involve, challenges and stresses such as a threat to survival, you know this, threats to your identity, your role and your function, loss. It's there. There are losses involved. There's also a lot of new and unfamiliar experiences that none of us would wish on anybody, but we've never had to encounter before. For some people, though, it's actually a return of past difficulties. Maybe they've had other health problems in their life, and this is the latest one. Or maybe this situation confirms important meanings for us. Like, sometimes I talk to people who have lived their life feeling like they're being punished by God. Here's another confirmation for them. So sometimes living with cancer can be stressful because it's reminding us of the past or confirming really important stories for us. I also want to acknowledge that we need to think about people as systems and the impact or living with cancer in a systemic sense. So certainly you can see there by this slide that there are biological impacts, there are psychological impacts, so by that I mean feelings and thoughts. There are also impacts on our social world and our spiritual and cultural beliefs, and also the behaviours we use to cope with all of that. But then we need to remember that individual people with the diagnosis also have family, and that's also impacted, and our people or families. And also your healthcare team are impacted too. And all of that creates a big system. So when we're talking about the impacts of cancer, we've got to think about all these players. And I think this is from a book, or concept from a book by Dr. Russ Harris, who is a GP who is actually working more as a psychotherapist now in people with mental health difficulties. He's written a really interesting book called The Reality Slap. And really what he's talking about is how we live life in a fairly familiar, finely tuned harmony or balance. We develop preferred ways of coping and living. But then something happens that casts us or slaps us in the face and pushes us into a new and unfamiliar reality that can be really, really destabilising, and we have to modify how we cope with life. And the worst thing about that is we know what life used to be like and how we prefer things to be. But the reality is that might no longer stand up. Things have changed. And it's in the gap between those two that our distress shows up. So you're sort of wondering, why is it that all of a sudden I'm having lots of difficult feelings, thoughts, my relationships are going haywire, I'm struggling with things like pain and nausea? It's probably because of this gap and how you're noticing it. Fortunately, there are ways that we can bridge that gap, or, as in the case of this abseil, scale it and manage it. There are lots of common reactions to cancer, and these are usually temporary, or they come and go in waves. So we do know that people experience acute stress reactions, or fight or flight. You can see I've included some other words there that sort of might capture some of those experiences. Insomnia, loss of appetite are common experiences for people who are under extreme stress because of these significant changes and threats. People do have lots of feelings. You can see some of the feeling words that are there. I think this situation also asks people to think a lot about their existence and what's spiritually meaningful for them. It does make us think about dying, meaning and what's meaningful in life. But also it helps us realise that things are pretty unpredictable and we don't have a lot of control over our lives. That's really threatening. I find that threatening. I'm sure other people do too. Relationships can also be very significantly impacted, and I've included there some catchphrases for what can happen in relationships. So you might find in this really stressful situation you react by trying to move towards people and needing more and more support. You might actually find you prefer to move away from people and isolate yourself and cope on your own. There are some people who find they have to fight with other people to try and cope too. There's also room here for avoidance too. As human beings, when things are tough, we turn away from them. It's part of how we help ourselves cope. And so we do need to acknowledge that some common reactions include things like denial or compensating, like trying to enhance things in other parts of our lives, using positive thinking, maybe even turning to alcohol and drugs to help us get through. And I think we certainly work really hard to make things more certain, more predictable, and give ourselves more control. We often do that by things like blaming, worrying, planning, researching, demanding, giving up, or even striving for things. So these are common reactions that patients have shown to me. And yeah, I think they make a fair bit of sense. If we think about what's common as being a normal reaction, then in the case of cancer, we need to say mental health disorder is quite common. There is extensive research evidence in cancer care showing that there are higher levels of depression, anxiety disorders, post-traumatic stress disorder, substance misuse compared to the general population, and also compared to other healthcare groups or patient groups. We do know that when mental health disorder and high levels of distress for people affected by cancer aren't treated, it has significant impacts on things like their pain, their tolerance of nausea and diarrhoea, their treatment participation, quality of life, service use, survival, and the well-being of bereaved family who live beyond the person. So it has a big impact. Fortunately, there is also extensive international research showing that psychological therapies are very effective in helping people with these issues. And fortunately, our state government recognises that and puts in place services like the one I work for to assist people. Another slide it felt really important to include here under common reactions to cancer is, given all that nasty stuff, all that heavy stuff, it's really common for people affected by neuroendocrine tumours and other cancers to experience growth and adaptation. So people tell me about how they find their connections with their family and friends deepen. They might develop or adjust their roles and responsibilities in ways that they'd never want to see turn back. They get clear about what really matters and what their purpose is. Life can get simpler by choice or by necessity. Sometimes people are able to make a push for greater health and fitness and motivation, which is great. And yeah, we can usually learn resilience, like we can develop, it can force us to develop the ability to bounce back. And I guess, yeah, we can learn a fair bit too. So it feels really important to hold this up here. And I've included the picture of the lotus because as the thing about a lotus, a beautiful flower, it grows in mud and swamps. Okay, so in the most difficult of circumstances, there are opportunities for us to potentially grow and adapt. This is a bit of a technical slide that I often will show to health professionals to help them understand who might need help from someone like a psychologist. And I guess what I want to emphasise is that how cancer affects people is on a continuum. And it's actually really healthy and adaptive for people to experience being really scared or anxious, sad and angry, confused, grief-struck, doubting, and to have things like insomnia and appetite loss or to disengage from relationships, as long as that occurs in a brief and reactive way. And it feels manageable for the person. And they find their coping strategies that they already have help them adapt and grow through it. And that's most people. And actually what that can translate into is people being quite motivated, empowered patients who engage in their own healthcare and recovery. But at the other end of the spectrum, sometimes these sorts of situations persist over time. They can be overwhelming and really disruptive to people's relationships and functioning. And people in that at that end of the spectrum, this group, tend to start to use coping strategies that are really inflexible and self-defeating. And it gets harder and harder and harder. And I guess that's a sort of a simplification of what we'd call things like mental health disorder. You can see them here. And at worst, suicide, homicide risk, psychosis. So I guess that's a bit of I include this slide to sort of say, this is actually a normal and healthy response to a situation like cancer. But we've got to watch out for ourselves and our loved ones when this starts happening. We start getting bogged in the suffering. That might be when we need to think about seeking help. And as I've mentioned before, people who do end up here really struggle to participate effectively in the cancer care. They tend to have poorer treatment outcomes. As I've put their non-compliance. Sorry, I forgot about that little bit of animation. So a couple of questions here you can ask yourself. When does my reaction to cancer become problematic? Well, is my distress overwhelming me or other people? And it's important to ask those other people that, because your mind will very quickly tell you that your distress is overwhelming other people, but you may well find in reality it's not. So ask people around you, is this too much for you? What's happening for me? Is it hindering me in relationships, activities or treatment? Are the ways I'm coping helping me? That's a really tough question to ask because often we choose coping strategies that really are about a self-fulfilling prophecy. But helping me, and I've got a few slides coming up about how do we define helping me. I guess really, am I living life consistent with my values and experiencing vitality and meaning in the presence of cancer? That's the important question. And I encourage you to think about that question when you're asking that question of, is the way I'm coping with this helping me? Is it helping me be the sort of person I want to be in areas of my life that are important to me, perhaps here, and to the extent that I have some degree of vitality and meaning. Living well. So well, it's an interesting word, isn't it? And as you might hear from my introductory comments, it's really hard for us to define well. I think it really has to be multidimensional, so including our relationships, our biology, our spirituality and our psyche. And what defines living well? Well, I encourage you to think about your health and safety, fairly important and primal, but also belonging, esteem and pleasure. What are your core values? What's your creed? What do you want to live by? What do you want people to stand up at your next birthday and say, I've got a lot of respect for Joe because he does this or he stands for this? Really think about that. And do you have roles and responsibilities that you're really proud of and get a lot of meaning participation out of. Living well can sometimes, not for all people, involve goals and projects. Certainly spirituality and cultural beliefs are part of living well for a lot of people. And this is going to vary a lot depending on your developmental stage of your age. So younger people might have different values, different projects, different priorities to older people. I've included the compass there just as a bit of a reminder that north is always true. So in a way, I encourage you to think a little bit about things like your core values, but also the key domains of your life, like what and who is really important in your life as north. And make all your decisions about what you're going to try and do, how you're going to cope, whether things are impacting you in a significant way according to north. You've also got to recognise that that'll change over time too. As I was saying before, this sort of health situation can force us to rethink what's a priority and form new meanings. So we have to hold this somewhat lightly or flexibly. There's been a lot of research that's been done to look at what strategies, resources and approaches can help people adapt to chronic illness, but also to cancer. And I've included some of them here. So certainly attention to healthy body does have a lot of research behind it to show that it can impact your quality of life and living well. There's a lot of research for the effects of exercise on mood and anxiety. The old ABCs, now the state government has the Act, Belong, Commit public health message. I'm interested in that, though I think that really has a lot of place to be put up in lights a bit more around our community. We don't see it a lot, but really engaging in activities. So living with a chronic illness, but also trying your best to ensure you're engaging in activities that bring you a sense of pleasure, some mastery, a sense of I can, and also meaningfulness. Belonging. We are incredibly social people and creatures. Belonging to groups and contributing to the life of other people is really important for human beings. And having commitments for ourselves, but also towards our community, also is really important in terms of helping people adjust. And just in terms of supportive relationships, so it is sometimes the case that people have a lot of support from their family and friends, but that support doesn't quite align with what they need in the way of support. A few people chuckling away there or nodding. So it's a really difficult thing for a family, for instance, to match the support they want to give to a person to what the person actually is willing to take or able to receive. And I guess that support has to be focused on empowering that person, not doing for or taking over that person. There's a lot of research to show that if people can be engaged and assertive participants in their healthcare, that can really help their mental health and adjustment to illness. I believe there's research too to show it can actually help the treatments be much more effective. And I do know there's research to show that health professionals get a lot more quality of life and meaning out of their work when working with engaged and assertive patients. So it becomes a relationship of care, a team. Okay, it's good for patients, it's good for health workers. Realistic optimism and hope are also known to be very important. I say realistic optimism because there's no benefit, in fact it's quite toxic, to have false optimism or unrealistic optimism. So we have to be realistic about how things are. We have to draw on good knowledge and wisdom from our healthcare professionals about future possibilities, but optimistic about that. Okay? So it's a bit of a difference to the power of positive thinking, for example, which as a psychologist I know there's research to show is actually quite toxic for people, or difficult for people. There's the way that we go about coping with challenge. So there's a couple of catchphrases here. Fighting spirit. So that's really like, okay, this is here, it's landed in my or our lap. How are we going to work with this? Let's work in a realistic, optimistic way to try and make this better for ourselves. That's what fighting spirit would look like. And active coping. So again, adopting an active stance that sees you being the captain of the ship, driving the direction you want to take things in, making choices about how you want to try and adapt or adjust, and about whether you seek help or not. I've mentioned before about bewaring the tyranny of the positive. We put a lot of pressure on ourselves in this community to only think and feel positively, and this really gets amplified in cancer care. And I haven't met a patient yet who's told me that that's been helpful to them. Also, it's really important to maintain, now this takes a lot of practice, perspective on what your head is saying. I can see a few people going, yeah, we know this, but it's so easy for us. I do it all the time, to fall into our heads. We live out the past in our heads, we live out a future. So often that's where our struggle starts and finishes. And I think a couple of hundred years ago, Mark Twain wrote, I've experienced some terrible things in my life, some of which have actually happened. Okay, so what I'm talking about here is being able to step back from your thinking and notice what it's doing. Because there's a hell of a lot of power in the words and images, memories, predictions that go through our mind on a daily basis. Gosh, if I had $1 for every one that went through my head whilst I was sitting waiting to present, I'd be a multi-millionaire. You know, it's all there. It's very human to have that. You might also hear, and particularly this is common at the moment in cancer care, a big focus on something like mindfulness, which often gets distorted into the ability to control what your mind thinks. If anybody's worked out how to do that, please let me know, because again, I will make millions. But we can't do it. That's my understanding. So actually, yeah, we've got to be careful about that challenge that's put to a lot of us of being able to control what we think, or only think optimistic or positive thoughts. Good luck. Oops, I need to go back, sorry. The other sort of thing that I'm going to speak about is really being careful about the stance we take to our emotions or feelings. They are essential. They're hardwired into us. Monkeys like apes and chimpanzees and orangutans have basically the same emotional reactions that we do. There's not a lot we can do to control them. They are an essential communication tool within ourselves and between people. They motivate and guide us. They also let us know when we're being mistreated or things are at risk. So we've got to honour and respect them. As I say there, they'll arise whether you like it or not. I guess the struggle then happens is we try to manage them, we try to control them, we tell ourselves off for thinking and feeling certain things. And I guess what I'm saying is perhaps it's going to be more helpful to take an open and non-judgmental stance towards the feelings that are already here. Let go of the rope, stop struggling with them, start to use them. And all feelings, positive and negative, now it's interesting terminology, even there we judge what are good feelings to have and what are not good feelings to have, are part of a rich and meaningful life. That's bad news for some people. A lot of people don't like to hear that, but I think it's a fundamental reality, is the fact that grief, loss, fear, joy, pleasure, they're all part of life. But so much of our community and the way we help people affected by cancer tells them only to have certain feelings. There are also lots of stereotypes around about feelings, and I include this one particularly, because a lot of men who are affected by cancer have a lot of reasons why they shouldn't seek help or talk about their feelings, and this is just one of the examples that shows up. It's one of my favourite slides. And I guess you had heard me speak earlier about some questions to ask yourself, some things to notice that might indicate to you that you could benefit from talking to someone who might have some personal but preferably some professional and well-trained experience in helping people live well with cancer. So remembering what I'm talking about here is if you feel like your experience of difficult and challenging feelings, thoughts are persistent and disruptive, they're overwhelming to you and your family, and they're really making it hard for you to participate effectively in your cancer care, or to look after yourself well, or to engage in the sort of life you want to live, and you can't fix it yourself, maybe think about turning to a professional. Counselling isn't for everybody, but I reckon it's probably more helpful to more people than what actually turn up for it. And you can see a university in the UK had this nice little poster that they tried out with their student population. Sometimes people come to services like my own too because their family system struggle to talk with them about their cancer situation, and they need to be able to have someone outside of the family that they can share their experience with, get insights and directions through. That's great, but certainly at our service, that's not a good enough reason to come to the service. The service will challenge you to think about what's in the way from you basically being able to do that effectively with your family. We want to be able to help people be able to work with, talk openly with their families. So yeah, come along to talk to us about the challenges you're having talking about people, hopefully with the aim of getting you talking more with people. There are a range of service options in WA. These are presented on purpose in a certain order. So I have included the Cancer Council helpline, and I think you're going to talk a bit more about general support services and also the support services Unicorn provide. But the Cancer Council does provide good information and supportive conversations by phone. They do also run peer support groups around the state. They do have some other programs which are under incredible pressure at the moment, but they're important programs for helping people with things like finances. They do have quite a specific program for subsidising eligible patients to access counselling. It's quite limited, but at least it's with people who have some basic training in cancer care and an interest in helping people affected by cancer, and it's spread around the community. To qualify for that, you have to ring yourself. You have to call the Cancer Council helpline and talk to them about that, and they'll help you make decisions about whether that's the right service for you and whether you qualify for that assistance. I've included Canteen there because it's one of the few services that is specialising in helping young people, children particularly, who are affected by cancer. There does seem to be a bit of a gap in counselling services for young people who are the family members of people affected by cancer. We do have the wonderful Youth Cancer Service that's trying to assist patients and their families with cancer too. I haven't included their slide here. But Canteen's a good option if you think someone in your family, a child or teenager or young adult, could benefit from some counselling or opportunities to do activities, go to groups with other young people. There are a range of general counselling services that are already helping people affected by cancer or good at helping people with general issues that come up for people affected by cancer. Things like relationship problems, loss and grief, fears and concerns. And you can see I've listed some of the services available here in WA. The university training clinics, each of the three universities in WA, Murdoch, UWA and Curtin, all offer training clinics where clinicians are learning to become psychologists or clinical psychologists. They offer programs to people at a reduced cost, but with very good skills and supervision. So that's an option for people. There are quite a range of people in private practice with good general knowledge and good counselling skills. There are a smaller group who have some good cancer-specific knowledge. Then we get down to the last two options, which I think really are reserved for people who think they might be experiencing what we'd consider mental health disorder. So much more specialised services for people who might have depression, anxiety disorders, significant relationship problems or substance use difficulties. Talking to the GP is a really good option because GPs now have access to a rebate scheme where patients can have their fees subsidised by Medicare for counselling. And then WA Psycho-Oncology service, being a free public service, there's a lot of demand on the service. As you can imagine, the resourcing is limited. We do find we have to focus on helping people who have quite complex cancer scenarios or are finding things like pain, sleep, appetite problems. Some of the biological effects of cancer are particularly disruptive to their cancer treatment participation especially. Or as I say, people who have really complex mental health situations that are interacting with their cancer scenario. We consider ourselves the service best placed to help that group. We do work with the other levels of service by providing supervision and consultancy to those healthcare professionals. So it's not uncommon for a psychologist out in the community to ring ourselves up and say, hey, I'm seeing Joe Bloggs, this is his situation, I've got his permission to talk to you about it, what else could we be doing to help him? And we can guide and educate that health worker in providing that care. Okay? So there's a few different options. I've included our services website there. We only accept health worker referrals. So I've included the website because there is a referral form on that website. There's also information about how you can access a referral through the public health system to get to see one of our workers. Print it off and take it to your GP if need be and say, hey, refer me to this service, or I think I could benefit from their help. Okay. Perhaps I'll leave that there just for a moment. Yep. Okay. Thank you for your time.
Thank you so much, James. I just found that really quite refreshing, particularly around the ideas of, we hear a lot about, well, what are the challenges when facing a cancer diagnosis and what are some of the negative things that can happen? But, I found it really refreshing talking about some of the things, the ways that we can grow through this. I think, often when we do these forums, we do want to give you an update on the latest in treatments and clinical trials and management, and obviously we all really need to know that stuff. The great thing about being able to manage neuroendocrine tumours for a prolonged period of time is that we do have the rest of our lives to, and we want to stay as well as we can and live as well as we can. And so I really do appreciate, James, that, you're just sharing that knowledge and expertise and insight with us tonight. So it was a big change in gears from the medical focus, but I think really useful.